Hello, this is Dr. Lee Hildebrand with the Thrive with Dr. Lee Hildebrand YouTube channel. And today in my YouTube video, I am going to be discussing a topic that has had some interest in a lot of arenas and sometimes even in theater with dramatizations of this situation that people sometimes struggle with. Traditionally, this was known as multiple personality disorder, and it's been characterized in movies and things of that nature historically. It has since been changed in recent years to dissociative identity disorder. So today we're going to be discussing this topic, which is often misunderstood. It's been sensationalized in movies, and it's increasingly discussed in therapy circles. We're also going to explore how, and I'm going to start calling it DID for the purpose of the video so I don't have to say the full phrase every time, but explore how dissociative identity disorder, otherwise known as DID, differs from what many therapists call parts work. And this is an evidence-based approach commonly used in treating trauma and complex trauma. And understanding the distinction is crucial for clinicians, for clients, and for families in regard to this. So let's first ask ourselves, what is DID? Really, the definition is two or more distinct personality states or identity states, significant memory gaps that can happen beyond ordinary forgetfulness in terms of these different states, and then disruptions in consciousness or identity, or maybe even memory or perception and behavior that seem real distinct from one personality, if you will, to another within the same person. And then lastly, symptoms related to this that can cause distress or impairment in regard to somebody's functioning. And some of the common symptoms can include lost time, just losing track of time, dissociation, meaning not really being present in situations, internal voices sometimes, and sudden shifts in mood or behavior. Now, how does DID develop? Current research suggests that DID typically develops through severe, repetitive childhood trauma or abuse or neglect or attachment disruptions that can occur in childhood. Now, DID is generally understood as an adaptation to these situations and really a survival response that kids can use. When they're under extreme trauma, they will disassociate from the situation, and sometimes their personality will split into parts from a standpoint of protection. Now, DID differs because identity states are more separated, and they may involve amnesia and can significantly impair functioning versus the parts work that I was talking about. Now, everyone has parts of oneself. You might feel like you have kind of a critical nature at certain times. At other times, maybe with your children or your spouse, more of a nurturing nature. You might have a very small childlike part of yourself that's fearful, that just wants to be loved, wants to make sure that everything's going to be okay. So parts work in therapy is assuming that the mind is naturally organized into different aspects of oneself, and that's different than the DID. If you look at the comparison of the two, parts work is really a normal psychological phenomenon that we all experience. We have a unified sense of self, and it just has these characteristics in terms of different parts. In terms of DID, this is a clinical disorder, and it's identity fragmentation, where literally sometimes these parts are distinctly separated within the person. And there's memory gaps that may occur too. Now, what are some of the treatment approaches if you have this experience with DID yourself, or you have a family member that has this? Treatment often will focus on safety and stabilization, really helping the person with the DID to regulate themselves emotionally. Sometimes it's very hard to regulate oneself, and the person can find themselves either predominantly leaning toward one of the personalities, in regard to even a protective manner. They may have a defender type of personality that they predominantly lean on, and sometimes unbeknownst to them, versus other aspects of themselves. Trauma processing is also part of treatment, and increased cooperation among the different states of the person with DID. And some of this trauma work can include psychotherapy, internal family systems therapy, EMDR, exposure therapy, and somatic therapies. And in regard to helping family members and spouses to cope who may have a person with DID within the family, here are some tips. One is to stay calm. Try to learn more about the trauma and the dissociation, and that's what I'm trying to help with my video today. Encourage the person to get treatment, to deal with their trauma. Trauma does not go away. One of the myths is that if you've gone through traumatic experiences and you just ignore it, that it will go away. That is a myth. That is not true. The anxiety related to the trauma will only increase even when there's avoidance. In contrast, if we deal with the trauma with appropriate treatment and appropriate treatment modalities, it can turn down the dial in regard to stress caused by trauma. Another thing that's important for family members and spouses is to have healthy boundaries, to set boundaries with the person with DID, and then also to seek support when needed. It can be very stressful to be in relationship with somebody with DID. You do want to avoid arguing about symptoms, and definitely you do not want to try to become your family members or your spouse's therapist. So some of the key takeaways here is that DID is a legitimate trauma-related disorder. Parts work does not mean a person has DID. Parts work is helping a person to bring more integration in regard to different aspects of themselves, that they bring all of those different parts to the table. And sometimes there's healing that has to happen with certain parts. For instance, that aspect of us that's been hurt in childhood situations, that's had certain types of trauma. So treatment really focuses on healing and stability and integration and cooperation in terms of the parts. And the other thing that's important is family education and support in either of these situations can really improve outcomes. So I just hope that my taking this time today to talk a little bit about DID as well as parts work and the differences between the two has been helpful for you. If you want to learn more about this in terms of your own situation, your families, please don't hesitate to reach out to us at Lakeshore Psychology Services. We have clinicians that are very adept in these areas. And it's my hope that my video today was informative and that it can help. So thank you so much for tuning in to Thrive with Dr. Lee Hildebrand, where I seek to assist you in making the best of your life, living it fully, and thriving in the ways that you can. Thanks for tuning in.